Hi, everyone. My name is Kashari Davis, and I'm here to present my week four patient presentation in this discussion. This patient's initials is MP. She's a 65-year-old female. She came in with a chief complaint of congestion, stuffy nose, throat irritation, cough, and shortness of breath at night. For the HPI, this patient is an inpatient rehab female, 65 years of age, who's complaining of shortness of breath, stuffy nose, throat irritation, um, and a cough at night with also with congestion. This patient states these symptoms have been going on her whole life around the same time of year. Um, she also said that she tried controlling these symptoms her whole life with medications such as cough drops, cough syrup, and Claritin that only provided temporary relief. She has a history. She told me she had a history of diabetes and takes metformin. Um, she denies anything making the symptoms worse. And when she has the coughing fits at night, she says that the discomfort is an 8 out of 10 on a 10 to 10 scale. She denies having any other respiratory symptoms and denies just getting over or recovering from any viral or bacterial infections. She denies smoking. For her past medical history, she had a hysterectomy in 2000. For her hospitalization, she was in a motor vehicle accident in 2019 for which she was hospitalized for. And she has no known drug allergies, and she has an environmental allergy to pollen. For her medication, she's just taking metformin, oxycodone, Tessalon pearls, and Claritin. For her family history, her mother had diabetes, has diabetes because she's still living at age 85 years old, and her father has hypertension and hyperlipidemia, and he died at age 76. She's current on all her childhood vaccines, um, and her last flu shot was given last year in December, and she denies any psychiatric history. She denies cigarette or tobacco usage. She denies alcohol usage, and she's a retired single female, and her hobbies include reading. Her review of symptoms was pretty much negative, besides what she discussed her ongoing symptoms have been. And she also stated when I did the review of systems that she had positive, that she did have some postnasal drip, so she was positive for postnasal drip. Her vital signs, her heart rate was 85, blood pressure 151 over 79, respiratory rate 16. She said her discomfort was an 8 out of 10 from the symptoms she's having, and she didn't really describe it as pain. And she's 98% for her O2 stat on room air. For her exam, she did have some generalized bruising on her skin from the wreck that she was in. Her eyes were fine, um, negative for any acute abnormalities. They were equal and reactive. Her pupils were equal and reactive to light and accommodation. Nasal, her nares, they were red and moist, and her inferior tubernates were extremely red and bilaterally with 3+ swelling. Her nares were patent bilaterally. She did have slight sinus pain upon palpitation. Septum was midline. Throat, her oral mucosa was red and moist, um, without any lesions. Her tonsils were present with swelling, um, +2, and redness. Her neck was non-tender, in the cervical area. No lymph nodes palpable. Neurologically, she was alert and oriented times 4. For her thoracic and lungs, they were symmetrical with good expansion. Respirations were even and unlabored. Breath sounds, she didn't have any crackles or wheezes or adventitious lung sounds. Cardio wise, S1 and S2 were heard. No murmurs or anything like that. And as she stated, she did have the symptoms that she talked to me about. For her differentials, I did allergic rhinitis. Allergic rhinitis can present with clear rhinorrhea, um, proximus of sneezing and itching of the palate or nose. Asthma was another differential. Common symptoms are wheezing, shortness of breath, cough, and chest tightness. And then sinusitis, facial pain worsening with bending over, fever, chronic cough, halitosis, headache, purulent nasal discharge, or toothache can all be caused by sinusitis. So for her plan, I, I'm going to draw CBC to check for elevated white blood cell count and possible infection. Throat swab to check for strep or respiratory and a respiratory swab panel to check for respiratory organisms. For diagnostics, I did a chest X-ray of the sinuses in the chest, consult pulmonologist for a pulmonary function test to rule out asthma because she never had that done before. And educate the patient on the use of pulmonary function tests and other tests to rule out asthma. Educate the patient on how a pulmonologist specializes in the respiratory system and can come up with a more accurate diagnosis and treatment plan. Um, and then for um, a part of the plan as well is for I diagnosed her with allergic rhinitis for now. And I already said I was going to check a CBC for infection, chest X-ray and sinus X-ray to rule out sinusitis and other upper/lower respiratory issues. Refer to pulmonologist for a pulmonary function test to rule out asthma. Follow up in 2 weeks, and then Flonase. I added that to her list. 1 to 2 accutations in each nostril every day for 1 week. Change Claritin to Xyzal, half a tablet PO every night PRN. And then diabetes, continue metformin 500 milligrams BID from her Malaysia related to her motor vehicle accident. Just continue 10 milligrams of oxycodone every 4 hours. PRN pain um, for a pain level of 6 out of 10, and continue physical therapy and follow up in 2 weeks. And that's really it for this patient. Thank you for tuning in.